In the third section, now we will talk about another procedure known as the radical mastoidectomy. And like we discussed, the indications and anesthesia and position of cortical mastoidectomy. So in this section also we will talk about the indications, position, anesthesia of radical mastoidectomy, and what are the steps of operation for radical mastoidectomy, post-operative care of the patients and complications. So radical mastoidectomy is the procedure to eradicate disease from the middle ear and mastoid without any attempt to reconstruct the hearing. So in this, we eradicate this disease from the middle ear and mastoid, and we do not try to reconstruct the hearing. Indications for radical mastoidectomy. In this diagram, you can see this is the ridge lowering. Ridge is lowered using the polishing burr. So rotating of this burr causes lowering of the ridge. So indications of radical mastoidectomy is when all cholesteatoma cannot be safely removed. So indications when all cholesteatoma cannot be safely removed, we perform radical mastoidectomy. If previous attempt to eradicate chronic inflammatory disease or cholesteatoma have failed. As an approach to petrous apex, removal of glomus tumor, carcinoma of middle ear. So all these are the indications in which we perform radical mastoidectomy, and it is the procedure which is performed to eradicate or remove the disease of the middle ear or the mastoid without restoring the hearing. And these indications are when the cholesteatoma cannot be safely removed, if previous attempt to eradicate chronic inflammatory disease or cholesteatoma have failed, and as an approach to Patrick's apex, or as an approach to remove the glomus tumor and carcinoma of the middle ear. Anesthesia and position. Anesthesia, again, like cortical mastoidectomy, is mostly the general anesthesia. Local anesthesia can also be used in radical mastoidectomy in selective cases. Position is the same as for cortical mastoidectomy. So patient is supine, lying on the back, head facing to the side, with the ear needs to be operated facing upward. Steps of operation for radical mastoidectomy. Incision, postural or endaural incisions are used. Retraction of soft tissues and exposure of mastoid area. Removal of bone and exposure of attic and antrum. Removal of the bridge and the buttresses. Lowering the facial ridge. Toilet of middle ear. Inspection of the cavity and irrigation. Meatoplasty. Obliteration of the cavity, closure of the wound. So all these are the steps of the operation that can be performed for the radical mastoidectomy. Incision, which can be post-oral or end-oral. Then we retract the soft tissues and expose the mastoid area. Removal of bone and exposure of attic and antrum, removal of the bridge and buttresses, lowering the facial ridge, toilet the middle ear, inspection of the cavity and irrigation of the cavity, repair of the meatus, obliteration of the cavity, and closure of the wound. Post-operative care dressing. First dressing is on third or the fourth day after surgery. Replace the outer gauze and cotton. Look for any sign of perichondritis or infection of meatal pack. So if there is any infection, you will see the sign of infection like any pus with the dressing. So that indicates that there might be some infection in the ear. Second dressing on sixth or seventh day. Stitches are removed, meatal pack is changed. Thereafter, usually the change pack at weekly intervals or leave the cavity unpacked with regular suction and cleaning till the epithelialization is complete. So dressing is important. First dressing on the third or fourth day after surgery. Any outer gauze and cotton, replace that and look for any sign of infection if present. On sixth or seventh day, usually the stitches are removed, meatal pack is changed, and then after that, change the pack at weekly interval or leave the cavity unpacked. Usually you can leave it open or keep on cleaning and sucking the site. Suction can be performed till the epithelialization of the wound occur. Antibiotic is used for a week. Cavity care periodically checked every 4 to 6 months. Complications that can occur as a result of radical mastoidectomy. Facial paralysis, you can see the facial paralysis. Facial nerve supplies the muscles of facial expressions, and there is ptosis, you can see, and there is bulging of the eyeball, also inability to close the eyelid. There is deviation of the mouth to one side. So all these can occur as a result of the facial paralysis. Perichondritis of pinna, inflammation of the cartilage of the pinna can also occur. Injury to dura or sigmoid sinus can also occur. Labyrinthitis if stapes gets dislocated. So labyrinthitis can also occur if stapes get dislocated. So these are complications associated with radical mastoidectomy. Severe conductive deafness of 50 decibel or more occur as a result of radical mastoidectomy, as a result of complication of radical mastoidectomy. Cavity problems can also occur. So these are all the complications associated with it as a result of post-operative care. Dressings are important. We should do the first dressing at day 3 and 4. Change the dressing. Look for any sign of infection if present. And then we should do the dressing again. Stitches are removed at day 6 and to 7th, and then we can do the dressing or we can leave the wound open. Daily cleaning and suction should be performed, and keep on performing these procedures until the reepithelialization is complete. So that was all about section 3, in which we talked about radical mastoidectomy and what are the steps of the operation for radical mastoidectomy, indications, radical mastoidectomy as compared to cortical mastoidectomy, in which we remove the mastoid air cells, all the accessible mastoid air cell, and create one cavity. In radical mastoidectomy, we are mainly performing it for eradication of any disease present in the middle ear or the mastoid, and we are not restoring any hearing loss associated with this. Different indications, different abnormalities of the middle ear and mastoid are treated by performing radical mastoidectomy. And then we talked about some complications and the post-operative care of the radical mastoidectomy. Thank you for watching sqadia.com.